All right, it's 6 o'clock. Let's get started. Today, I think we're talking about a very, very important topic, at least very important for women. I see a lot of news on health. And I know if you're like me, you're a little bit confused because there's so much data coming in. There's so much WhatsApp messages coming in, and these WhatsApp forwards sometimes can be accurate, sometimes not accurate, but they cause a whole lot of confusion in our minds. So today we're talking about women health issues and the pandemic. We've got Dr. Urvashi Sehgal, who's a senior gynecologist. She's the director with Phoenix Hospital and a visiting consultant with Apollo LaFemme and Rosewalk Hospital. The pandemic has affected women's health in many ways, and we're not able to get proper OB-GYN care. We also have a lot of questions regarding corona, its effect on periods, pregnancy, postnatal care, fertility, hormones, menopause, vaccinations, and so many more. That 1 hour definitely is not going to be enough. So we're going to try to get the most important questions answered. So Dr. Urvashi will try to answer as many questions as we can. She's a senior consultant with a special interest in IVF and high risk pregnancy. She was the pioneer of the first water birthing technique in India. She's also received the Distinguished Service Award from the Delhi Medical Association and the Indian Medical Association. So, Dr. Urvashi, welcome to Sipping Thoughts. We're very happy to have you here.
Good evening, and thank you for having me here, Sukirti, and your team at Sipping Thoughts.
So, Dr. Urvashi, let's get right into it. So, what are the most common questions that you, as a gynecologist, are being asked right now?
So, actually, the most common question that I've been asked the last couple of weeks is, can I take the vaccine in pregnancy? That is the most common question. And after that, I'm breastfeeding, can I take the vaccine? And then there are questions like, supposing I'm COVID positive, and I'm about to deliver, what will I do? What will you do?
So,
So,
Dr. Urvashi, let's get started with those because I think those are the most common questions that we're also hearing. And so, let's get started. So, if you're pregnant, can you actually take the vaccine? And let's go through all the different phases and in which phase can we take the vaccine and which ways can we not? So, pregnant women and the vaccine.
so actually, in the first wave, pregnant women were miraculously um, sort of kept safe because the COVID virus seemed to sort of not affect them as much. But in the second wave, it's been pretty disastrous. So we know now that pregnant women are very vulnerable and they are candidates for being vaccinated. They really need that protection. But because the vaccine hasn't been around for so long, it's not been tested, although in the West they are giving them, but in India as yet, we have not been given the go ahead. So we are really hoping now that, this is told to us that it's safe to immunize the pregnant women and give them the necessary protection. And I hope it is sooner than later.
Now, the second one that we get asked a lot about lactating women and the vaccine.
So just very recently, less than a week ago, we got the recommendation that we can go ahead and vaccinate the breastfeeding mother. So we are really happy about that. And actually, immunizing the women, the breastfeeding women, is going to give them antibodies that they'll pass on to their babies through the breast milk. And hopefully that will give the babies protection.
Now, the third question that we keep asking in terms of the women, I'm on birth control and I'm planning to have a baby. Should I take the vaccine?
Well, if you're planning to have a baby, yes, that is not a reason for not taking the vaccine. You should go because it's not going to have an impact on your fertility. It's not going to have an impact on your ovaries. And vaccinating is going to give you protection that you will need during your pregnancy.
Now,
And even if you discover a day after having taken the vaccine that you were pregnant, it's perfectly safe. You don't have to terminate the pregnancy.
now the big one that we keep getting, and this question is, I how should I plan my vaccination? Should I plan it? Is it okay for me to take the vaccine on my periods? Should I be planning it when I'm not on my periods? Is there anything that I should be thinking about as a woman when I need to take this vaccine, or is it just Whenever I get the date, please go.
So generally, all vaccines, we do advise that um, take it when you know that you're not pregnant. So as soon as you've had a period or you're having a period, it doesn't matter, because with vaccines, you have to be registered. There is a certain time that you will be able to get it. It's not like you can just walk in at any time and you'll be vaccinated. At least now it's not like that, because they are in short supply. You register yourself and you get the vaccine as and when it's available to you. So whatever is available, whenever, take it. But the just one moment. Yeah, right. So coming back to that. So if you have missed your period, of course, it's best to do a pregnancy test. But if you haven't missed your period, or if you're on a period, it's fine. There's nothing like you can't take the vaccine if you're menstruating or not menstruating. That's all. Those are all myths.
Excellent, because that is one that we keep hearing about. Now, Monisha is also asking a question. Now, if you're a menopausal woman and you want to take the vaccine, any special symptoms that you should look for?
Well, so the vaccine seems to cause some hormonal changes in women. Those are transient and those are not serious. So it's not that you have to look for anything, but once in a while, postmenopausal women have said that when they took the vaccine, after that, they had a little spotting or bleeding. That may happen because of the reaction that the vaccine may cause to the immune system, which has a connection with uterine bleeding. But all postmenopausal women who have spotting or bleeding after they've taken the vaccine shouldn't just presume it's because of the vaccine. So whatever has to be done, they should consult their gynae. Whatever investigation has to be done for postmenopausal bleeding, they should go ahead with it, like whether an ultrasound is required or anything else. But yes, it is known to cause irregular bleeding in postmenopausal women and also in premenopausal women.
Now, another question that keeps coming up with women that are having their periods, they're saying that if they had COVID or took the vaccine, their periods are also irregular.
Yes. So this is all kind of connected. That there are these, like I said, temporary episodes, effect of the vaccine on the ovaries. It may cause some sort of ovarian suppression. And sometimes, of course, when women have COVID, they are given drugs, they're given steroids, which may also impact their hormones. So it's like a whole thing about so many different things, and anxiety as well. So that does disrupt the menstrual cycle. Yeah.
So we're getting
but it's all temporary and nothing, it'll pass.
When you say temporary, because I think we get very worried, how long is that phase? Is there some duration? Because I think
I would say it could last up to 6 months.
Okay. So it is a serious temporary, meaning 3 to 6 months, because I think what happens is we expect things to go back to normal like immediately.
No. Because there are things like long COVID, which may just go on for 6 months. Yeah.
Now, Shubhangi is asking this question. If the guidelines are not in favor, can vaccination be taken in the 9th month of pregnancy?
As a doctor, I cannot really comment on that. These are personal choices. So it's you do your research, you take responsibility. But I have a feeling where your vaccination center will know wherever you go to that you're pregnant. So unless they are given the directive, you may not be given the vaccine in India till such time that it is.
Now, the second big question that you keep getting, and we are also getting, is that, all right, I am pregnant and I am COVID positive. What should I do?
Okay. So when a person is pregnant and discovers that she's COVID positive, there must be a reason why she went ahead and did the test. Maybe she had fever, and she contacted her gynae, and the gynae said, do your RT-PCR for COVID, and she turned out to be. Now, most of the pregnant women will be asymptomatic, which means, or mild symptoms like low grade fever, mild cold, headache, but they should contact a physician. And the physician is probably going to tell them, monitor your temperature, monitor your pulse, your oxygen saturation. And if everything is kind of stable, just take symptomatic treatment, take paracetamol for fever, hydrate yourself well, vitamins, and eat healthy, and don't be too anxious. But if your symptoms get worse by day 5, by day 7, if the fever becomes high grade or persists, there is a severe cough, breathing difficulty, then it could be getting a little more serious. And then the physician may ask the pregnant woman, because in pregnancy, you don't want to do home care if things are getting a bit moderate to severe, may ask the pregnant woman to get admitted.
The other question that we keep getting is now, okay, if I am admitted into a hospital and I am pregnant, any special other precaution I should take? Or, you know, because I think we get very nervous at that point.
Right. So when you're admitted, you're under care, strict care of a physician and an intensivist and a gynae there. So all the necessary care is being done in terms of the monitoring of the baby's well-being and the monitoring of the mother's well-being, and whatever drugs need to be given are being given. And of course, what you should do is eat healthy and try and think positive, and keep yourself as calm as possible, and report anything unusual to your caregivers.
Now, the second question is always about the lactating mother and if she is breastfeeding and she has COVID. So, how do you separate, and should you separate yourself from the child? And how do you actually care for the child in that situation?
So if it's a newborn or a child that is being breastfed, you don't separate them. And it could be either of the two scenarios, that the baby will be negative for COVID or positive. If the baby is positive for COVID, then of course all those uh, questions and concerns about what to do are not there. But if the baby is negative, then the mother has to take precautions in terms of wearing a mask and sanitizing her hands when she's handling the baby. And the baby may or may not be kept in the same room, but if in the same room, then there has to be a distance between the mother and the baby. But you continue to breastfeed. You never stop breastfeeding, because breast milk actually will give antibodies to the baby and protect it to a certain extent.
No, that is very good to know, because I think this question does come up quite a bit, that whether you should continue to breastfeed or not breastfeed the baby. Another one that has actually coming up quite a bit, and at least we're reading the articles, that women that have PCOS or PCOD are actually at a greater risk for getting COVID. I mean, this was reported in leading newspapers as a big risk factor for COVID.
Right. So actually, there are certain women who are at higher risk. And those are women who are obese or have diabetes, high blood pressure, certain other diseases like the liver, or vitamin D deficiency, or a dysbiotic gut. Now, coming to polycystic ovary, there are different types of polycystic ovaries. There are ones which is associated with high testosterone level, with obesity, and high insulin resistance. Now, these are the women who are at higher risk because of higher amount of testosterone and also high insulin resistance. So they may be at higher risk.
Okay. Any other women that are at higher risk?
So like I said, the ones with these comorbidities and high risk factors, with obesity and diabetes and high blood pressure.
Now we're seeing in this wave, there are a lot of younger kids and even babies getting COVID. Any special precautions? Because I mean, I think none of the medicines or any treatment that is available that is standard for them.
Right. So protection for children and babies, it is actually two-pronged. One is that their caregivers, that they should not be exposed to infection. That's number one. And how are they not exposed to infection? That their caregivers don't infect them. And caregivers should be totally immunized. That'll help to prevent that. And secondly, of course, all the COVID precautions, COVID appropriate behavior, as it is called, with all the hand hygiene and, staying indoors and not having people who are not living in the house moving in and out of the house. So that is all very important. And then, of course, building up their immune systems by giving them a diet which brings up their immunity, which has, vitamins and minerals, which will make them stronger and more protected. So these are the things that we can do too. And then, just in case, of course, protection is also for babies and children who contract COVID, and how to handle that, and so that it doesn't become serious. So whether it is mild, you should be in touch with a pediatrician who you trust and follow his instructions and monitor the child at home. And you should know if it is turning serious, report that to the pediatrician, so that if the child needs hospitalization, that is done without delaying and things do not become complicated.
So yes, a lot of people are asking if there's a Q&A schedule. Yes, there's a lot of Q&A schedule. We'll just move into that. I just want to make sure that we get all the common questions answered so that, we don't have to repeat them in the Q&A. I think the last one that we are getting, and quite a lot, is about sex and corona. And can you actually get corona through sex?
So corona is not sexually transmitted in the sense that the virus is not found in semen or in the vaginal fluid. So but any closed contact, which is less than 6 feet or 2 meters with an infected person, can give you infection from a person who's infected. So sexual activity definitely means close contact. And saliva contains the virus, so that is infective, and nasal secretions can and do contain. So those are infectious. So I think if you look at it from that point of view, yes, close contact can give you infection.
So I'm going to start taking some audience questions now, if that is good. So we'll start with Ashly. Ashly, go ahead.
Hello, ma'am.
Ashly, you might have to speak up a little bit.
Hello.
Yes, go ahead, Ashly.
Good evening, ma'am. Right now, my aunt is suffering from cholesterol, sugar, as well as thyroid issue, and all this happens after COVID issue. She was affected by COVID, and right now she also feel a little bit eyesight issues. So, what the point she must be take care of it?
So from what I could make out, she's had COVID. She's already recovered from COVID.
She recovered from COVID.
And subsequent to COVID, she developed all these problems. Earlier, she didn't have any of this.
Earlier she was suffering from high sugar and cholesterol, right. But right now she started thyroid issues and eyesight issues are started right now.
Her eye issues, is that right?
Yes.
Yeah. So, so with high blood sugar, there can be certain eye issues that may, and when she had, was she given steroids?
Yes, she is taking insulin.
Okay. So although COVID won't directly cause eye issues, but indirectly through uncontrolled sugar or maybe some other pathology, there may be. So I think she needs to Is she consulting a good ophthalmologist, an eye doctor? Because that's what she must be, that's what she must do.
Okay.
Yeah.
Okay. Do she want to change her diet or something?
That, of course, has to be very controlled and restricted because she has both high cholesterol and diabetes. So that in itself, I mean, I'm sure she's already following that. And if she's not, definitely she should um, have a very strict diet, which will, um, bring her sugars and cholesterol
So
to.
what are the points we should consider while she was suffering from thyroid? So what are the points she must be care of?
Is something which a nutritionist will should make out for her. It's a very complicated thing, and it cannot be just covered in a minute or so.
One question I do want to ask you before I move to Smita. A lot of us have not been able to go visit the OB-GYN, or we've not been able to go for our regular tests. What are the ones, especially because we're stuck at home, that are mandatory that a woman should do or must do? So if you can give us some advice, because we know that this scenario is going to be there for another maybe 3 to 6 months also.
Right. So a lot of consults are being done as teleconsults, Zoom consults. But the ones that are very important is at 12 weeks, which is with an ultrasound, the 12-week ultrasound, a blood test, and also advice from a doctor regarding what supplements are to be taken. And those blood tests, this is a kind of anomaly screening at 12 weeks. Then the next very important visit is at 20 weeks. And that is when the level 2 scan is done. And at that point of time, again, there are certain blood tests and vaccination to be given. The third visit is at 28 weeks. This, what I'm telling you, is all for low risk pregnancies. High risk pregnancies will have to come more frequently as and when the situation demands, depends from case to case. So in low risk pregnancies, the third visit is at 28 weeks. And again, we club together an ultrasound and immunization, blood tests, and whatever advice that needs to be given, plus, of course, blood pressure and weight and all that as well. Now, pregnant women should be monitoring their blood pressure and their weight at home. So they should have their blood pressure instruments, their pulse oximeter, and their weighing machines. The last visit is at 36 weeks. Again, there is an ultrasound and there are blood tests and a checkup by the gynae. And after this, of course, we hope soon after 38 weeks, the girls will go into labor and deliver smoothly.
And anything for non-pregnant women, normal women, what is a mandatory test? Or can we just kind of say, okay, it's all right if we skip our pap smear or these tests for the next?
Yes, it is all right because unless somebody has abnormal symptoms like very heavy bleeding or something which is very distressing, but you always start with a teleconsult. And then if your gynae feels that this needs a physical examination or an ultrasound or something, then or a blood test, then you will be advised accordingly. So you first do a teleconsult and then see whatever can be solved. It may appear very serious to you, but maybe she'll be able to tell you just do a urine test, and then the urine test, you get the report and you get the treatment, a prescription on the telephone, and that will solve your problem.
I'll take Smita's question next. Go ahead, Smita.
Yeah, good evening, Sukriti. Good evening, doctor. I have 2-3 questions. Only one is COVID related. I have had both my shots, but is it mandatory to get a blood test done to ensure that antibodies are formed?
Actually, it's not considered mandatory because now we are sort of finding out that people who have antibodies may also get infection. So there's no point feeling disappointed or elated either way. If you don't have or if you have to take your precautions. There's no getting away from that.
And another question is, how long should one skip a period to ensure that you are post the menopause phase?
Okay.
Because mine keeps coming back after every 6-7 months. So
Yes.
it's been happening for 2 years.
Actually 1 year. So if you've
Achha,
been
continuously
without a
1 year.
period for a year, then you're officially menopause.
And one last thing, ma'am, of late I've been having a lot of eye issues. I already wear specs, but in the last 2-3 months, my eyesight has really gone down. Earlier, I used to, just needed to read a book, but even now when I'm cooking, I need it. So, is this maybe a menopause effect, or it's a general eye weakness related to age?
So, nearsightedness, meaning that not being able to read,
Yeah.
sort of that number keeps changing as you age. So there is a certain thing that in so many years it'll change that much. So that is part of the aging. But if it is like really a lot, then there could be something. But so whenever this COVID situation is over, I'm sure you should visit your ophthalmologist in case there is something else happening. Yeah.
Thank you so much, doctor.
We'll take the next question from Dharmika. Dharmika, go ahead.
Yes, ma'am. Thank you. Good evening, ma'am. Ma'am, I'm willing to ask 2 questions from you. And my first question is, what is the major difference between PCOD and PCOS? And I heard that moon charged water will really overcome the problem of PCOD and PCOS. And ma'am, if someone is suffering from corona, so what are the factors that will cure the PCOD and PCOS?
No. So what will cure moon what?
PCOD and PCOS.
No, I heard that. But then you said something will cure some.
Ma'am, moon charged water.
Okay. No, I wasn't aware of this. What is moon charged water? I have a question for you.
Ma'am, moon charged water means the water that will keep under the moon rays. Yeah.
Oh.
And we have to drink that water. I heard from somewhere that, drinking moon charged water will, cure the disease of PCOD and PCOS. So I really don't know. Please tell me.
No, so I'm an allopath, which doesn't mean that I ridicule other systems, but as an allopath, I have no experience of this. So I would not be able to comment on that. And coming to PCOD and PCOS is a syndrome where there are all these things associated with polycystic ovaries on the ultrasound, and abnormal hormone levels, obesity, acne, excessive hair, and periods are delayed. In PCOD, it is just the ovaries that look polycystic on ultrasound, but other features may not be there. But it is actually something which has not officially, so for us as doctors, PCOS and PCOD is the same. But for the layman, I realize now that they are using these 2 terms separately. Right?
Okay. Yes, ma'am. And ma'am, my second question to you is, can pregnant women donate plasma?
No, they can't donate plasma.
Okay, ma'am. Okay. Thank you so much, ma'am.
The next question we will take from Monisha. Monisha, go ahead.
Yeah. Hi, doctor. In the menopausal state, there's a very embarrassing situation that I'm facing. It's with regard to, sorry, very embarrassing question, excuse me, but I have to ask it. It's with regard to urine control. The control becomes very difficult. And there are times when one literally has to rush to the bathroom. The rush is so tremendous. It's like as if there's a tiger chasing you. You have to run into the bathroom. And so anything one can do about that, because every time one steps out, not that one is going out now, but when you step out sometimes at parties or during a long drive, it becomes a prime concern. That's all that's going on in your mind. You're looking out for where's the bathroom and where's that. So is there a way out of this, or no, it's just menopausal?
So number one, it's not an embarrassing question. It's a very commonly asked, and it's a symptom which a lot of menopausal women have. What you're facing is called an urgency incontinence. And this happens because when you are menopausal, your tissues are deprived of estrogen. And estrogen is what gives strength to your bladder, your urethra, and your pelvic tissues, which are the ones that control or being able to control urination and being able to hold urine till you find a place that is suitable. So that is continence. So this urgency in continence is mostly caused by this. Of course, there are other things that need to be ruled out by doing your ultrasound, by doing your physical checkup, and then deciding what is the best treatment for you. But so based on the reason, if it is just purely menopausal and everything else is normal, then at times you're prescribed local estrogen creams to be applied in the vaginal and the urinary area, which will strengthen the tissues. And also you would be advised certain exercises to do to strengthen your tissues. Sometimes you may be asked to take certain drugs that will reduce this tendency of the bladder to start contracting, when it's not suitable for you to pass urine, contracting in an uncontrollable way.
Bhavna is asking
just one thing. So for that, I have to come and get a checkup done for you to be able to tell me what to do, right?
I guess when the COVID thing is sorted out.
When the COVID gets over.
Yeah. Then, and you're not moving out till the COVID thing is there. So
right.
The bathroom at home is always available, but you can start doing your exercises anyway.
So another question on menopause from Bhavna. She says, what are the other symptoms that we should watch to understand if you've hit menopause, and what precautions should we take?
Well, the main symptom is not having periods for a year. So, you've hit menopause, but that is retrospective. So while you're not having periods, if you're getting hot flushes, if you're having difficulty, in sleeping, and if there is maybe mood changes and urinary problems, vaginal dryness, probably your hormones are going along the way of menopause. And a good nutrition, keeping your weight under control, exercising, strengthening your pelvic muscles, and then going for your tests and seeing whether you need additional therapy, discussing with your gynae, whether other therapies are recommended. Would you like to choose some other things to help you tide over this time?
The next question we'll take from Ashly. Ashly, go ahead. Ashly? Otherwise, we'll take Preeta's question. Preeta, go ahead.
Yeah, hi, doctor. Doctor, I've been I'm turning 50 this year. And lately I've been getting headaches, which for no reason they start and then they continue for a day, sometimes more. I've tried all forms, which is typically that drinking water and, sleeping well, having caffeine and steaming in case nose is blocked. I've taken Disprins also, but they just don't go. So I just wanted to check if it is anything related to menopause, because I've not yet hit menopause. And second thing is, if not, who's the doctor I should ideally consult for this?
So you've never had these headaches before?
Never had headaches before, doctor. I just started about a year ago, getting them once every 2-3 months.
Okay, so you've not had headaches which are premenstrual or menstrual? Yeah?
Right.
That means you've never had headaches.
Never, not had headaches.
And you're getting periods regularly?
It's regular, doctor.
Okay. So then I don't think we should attribute it to being your hormones. Okay? Because people who have hormonal headaches would have at some point of time had menstrual headaches also, or if somebody's been pregnant during pregnancy, that makes one feel that a person is prone to hormonal headaches. So you must, if they are really severe headaches, then the best person to consult actually, if your blood pressure is normal, you should check your blood pressure, of course. Sometimes high blood pressure can cause. And if it is not high blood pressure, then the person to contact is a neurologist.
Okay, doctor. Okay, thank you.
The next question we'll take from Bhavna Malhotra. Go ahead, Bhavna.
Hello, thank you, ma'am, for having this session. I would like to ask that from past 2-3 months, I've been having irregular periods. From March or in March also, and April also, my cycle got delayed by 10 days. And recently, I've been prescribed some tests by my gynac to check for PCOS and thyroid. But I recently recovered from COVID. I mean, 3-4 days back, I tested negative. So, shall I go for these tests? I mean, right now, or I mean, should I wait for these tests until I'm in the recovery phase?
Yeah, so this is not an emergency, and you should first let your body come back to normal, because whatever blood tests that you do, they will not be your baseline, normal baseline. So let your body come back to normal, and that's the time when you should do these blood tests.
I'm getting a private question again on periods. Quite a lot of questions are coming in. Is it normal to have periods for only 2 days? I'm 32 years old and trying to conceive. And if not, can anything be done to increase the period?
Now, has the flow always been only for 2 days right from the time she started the period, or is it something that has started recently? And if it has started recently, what could be the trigger? Is it stress, or is it changes in the weight? So all these things
He's
have to be
saying it was
actually
for 3 days and now it has come down to 2 days.
Right. It could be related to weight changes, or her nutrition, or her exercise. It could be hormonal changes. So, you have to take it by symptom, and if it seems to be purely hormonal, there are no other factors, then there are a list of hormone tests that you have to do. Per se, there are women who have periods for 1 day only, and then they have no fertility issues. But if it has happened just all of a sudden out of the blue, then yes, she needs to have an ultrasound and some hormonal tests, and then.
We'll take Hema Sethi next.
Hi, ma'am.
Hello.
I have a little apprehension in my mind, like, I'm turning 38 and I'm trying for my second child.
Yeah.
So although it's been like almost 3-4 years that I went through my TB phase, which I catch directly from, after delivering my baby within 6 months. And that was like something which I went through, and I did my, full medication. And everything was fine, no major issues, just that sometimes I used to face in weather changes, like, cough and cold. But it's like, by God's grace, everything has been safe with me from past 1 year. I've been not taking any kind of medication and nothing. So, but then I'm a little anxious, like I've taken my first dose of vaccination also. So what suggestions do you have for me?
So in India, tuberculosis is a very common condition. And
Yeah.
since you've taken adequate treatment,
Yes.
and you feel normal, you don't have to worry about it. You can take your second vaccination when it is due, and take all the precautions that all of us are taking, and you don't have to be anxious or worried.
I'm going to take one question because I think I also asked you this question last time we met. I consulted one gynecologist for vaginal infection, and she gave me the advice not to use vaginal wash because it can cause dryness and all. Vaginal wash, is it a good to use or not good to use?
So you mean specific vaginal washes like V-wash and all those things? Well, it's fine to use them, but not continuously for a long period of time. So they are pH balanced, and you should never use soap for that area. And water is fine, but from time to time, you can use a vaginal wash which is not perfumed, which is chemical free, which is natural, and go by your symptoms. So when you use the wash, if it makes you feel more comfortable, then it's fine to use it from time to time. So maybe 2-3 times a week you can use it, and it's fine.
Next question from Zara. Zara, go ahead.
Hi, doctor.
Hi.
I wanted to ask, I'm 38 and I would like to do a blood test, which is like a general package I do once a year. So which are the tests, that is required for me to take within that package? And especially when it comes to hormonal tests, my thyroid antibodies showed high last year. So I'm just wondering which tests we should be taking. And also, do these have to be taken at a certain point in our period cycle, like maybe certain days after the period or during or something like that?
So if they are fertility hormones, then you need to do them at a certain time of your cycle. But if they are not related to fertility, then it's fine to do them after your periods are over. And these routine tests for a person from what I can understand, you don't have any issues. It's just a routine test which you do once in a year or 2 years. Is that
Correct. The thyroid antibodies and cholesterol showed quite high. That was the only thing that stood out.
Right. So these are routine tests. So if you actually tell the lab that you want a routine health check, they will give you certain basic ones, like which include your hemogram, your TSH, T3, T4, your liver and kidney, and the lipid profile, the sugar. If you would like to do your vitamin D and B12, you can tell them to add that on. And so these are basically what one needs to do. And many labs will add just like that, many more things which they don't charge for, but they'll make it a big package, which is all fine. But these are the basic ones that you
Sure, doctor. And any basic hormonal test to take?
Well, if you don't have hormonal issues, I don't see any reason why you should take them.
The thyroid antibodies is not taken as a hormone issue?
So when I say TSH, T3 and T4, that's your thyroid profile.
Okay. So that needs to be taken.
And thyroid antibodies, you don't have to keep repeating them every time, because if they are there, they are there.
So there's nothing we can do to reverse and bring it down?
No, those are antibodies, but you can make sure your thyroid levels are under control.
And how is that looked after, the thyroid levels?
If you do the test and if the tests show any abnormality, then your thyroid endocrinologist will tell you what to take. But if they are normal, then you don't have to worry about it.
All right. Thank you.
You're welcome.
Next question we'll take from Grace. Grace, go ahead.
Yes, hello, ma'am. So my question is, I am a 34-year-old and I weigh 75 kg and I'm 5'3". The reason I'm saying this is because my BMI is a little, it's in the average of overweight. So we are planning for pregnancy, and I'm using the app called as my calendar. So I was, my cycle is fluctuating. For the past 3 months, what was noted from my app, or my calendar, has been 35 days, 37, 39. So I'm confused as to how to calculate my ovulation because of this fluctuation.
So when you put this data into the ovulation app, it will tell you the window, which is 14 days from your shortest and the longest period cycle, and the window between those two dates is your fertile period. And the app will show you that, because it will always ask you dates of your last 5 periods before they start telling you, isn't it?
Yes, ma'am, they do.
Yeah. So then you have to keep calculating. It's difficult for you to calculate. So the app tells you. There's a good app called Overflow, I think. A lot of my patients tell me it's good.
Okay, I will check that. And my second question is, are there any signs of ovulation? Like, is there anything that how I should feel, or maybe the...
So you have to be very perceptive to your body changes to be able to tell. But there will be an increase in this kind of raw egg white type of vaginal discharge. and a cramp, a period-like cramp happening when you're ovulating. So these are the two things that when you perceive those, that means this is your, and if you find later that 14 days later your period comes, then that means it was the time that you ovulated.
Okay, thank you so much, ma'am.
You're welcome.
Lots of questions I'm getting privately, so I will ask them. There's a question again about the vaginal hygiene. So if no soap and vaginal wash, what should one use?
Say that again. Say
The
that.
vaginal hygiene. How do we take care of our vaginas? What should we be doing?
Basically, basic hygiene is, of course, wearing cottons. Don't wear synthetic and tight underclothes, and changing them maybe frequently, sometimes twice a day. At night, let that area be ventilated. Don't wear tight clothes at night. And when it comes to washing, plain water is the best. And so if your diet is high in carbs or processed foods, you girls tend to get more thrush infections, yeast infections. So keep your diet healthy, and also drink enough fluids, keep yourself hydrated. Vaginal washes are good from time to time when you feel the pH of your vagina in terms of there's irritation or there's some kind of an odor, which is because of a high pH. And if there is irritation, it's because of a very low pH. It's very acidic, and you're probably not drinking enough water. So you can use washes and rectify whatever is triggering it off. So that is it. Douches and using perfumes and chemicals is a no-no.
We'll take the next question from Purnima. Purnima, go ahead.
Yes, am I audible?
It's a little staticky, but we can hear you. Go ahead.
Yes. So I was diagnosed with rheumatoid arthritis at the age of 24. I'm now 48 years of age. I'm on a minimal dose of steroids. And just now somebody, can you hear me?
It's very broken. I can't hear it clearly. So you
maybe please just type out your question. That'll be better.
Can you hear me now? I've taken off my...
Now it's better, yes.
Yeah, so I was diagnosed with rheumatoid arthritis at the age of 24. I'm 48 years of age now. I'm on a minimal dose of steroid. But my question is not in regards to autoimmune disorder. I've done a lot of study myself. My question is, just now somebody asked about hyperactive urinary bladder. And, when it comes to the patients of rheumatoid arthritis, and especially if they have a history of steroid, they cannot undergo any surgery. So I pass urine every 10 minutes. This is something, I feel embarrassed, but I'm still sharing. What possibly can I do to get rid of this problem?
No, so this frequency is because of an uncontrollable urge to rush to the toilet. And
no,
that
every single time I do pass urine.
Because the incontinence that the previous lady asked me was more like an urgency incontinence, which means that the bladder starts contracting and she needs to use the loo, otherwise the urine will come out. But what you're saying is frequency. It's not lack of control, it's frequency. Now, frequency can be because of urine infections. It can be because of high blood sugar. It can be because of a bladder that has a low capacity, small bladder. Now, these things have to be investigated to find out the cause and then treat appropriately.
All right. There isn't any...
Sometimes it can also be there's some women who feel dryness in their mouth and keep drinking a lot. So if they drink a lot, the bladder will naturally get full very fast. So drinking enough is good, but drinking too much is again a cause of frequent urination.
I think what I do resonate with is it is not infection, and I'm not drinking too much of water. Perhaps something to do with the size of the bladder. So post-COVID, I'll try and find out.
Yes, right.
Now, a couple of questions we're getting on recyclable sanitary cloths. Are they safe during periods, the washable cloths that have come out? And the second question is, should we use panty liners?
Well, no to panty liners. It's better to change your panty frequently if you have an excessive discharge. And if you don't have excessive discharge, it's normal, then it's fine. And about reusable sanitary napkins, I am very pro that. I feel that it's high time and very important, but of course hygiene should be maintained, and do not use strong detergents and chemicals to wash them. So yes.
The next question we're taking from Girja. Girja, I can ask it on her behalf. She's in her 6th month of pregnancy. I have apple and orange juice daily. So my question is whether to have such juices regularly. Is it good for the baby? Or else when to stop having fruits?
Fruits are good to have. And certain fruits may not be good for you if you have high blood sugar. Juices, one is not in favor of. Fruits are all the goodness with the fiber. Juices are high in sugar. So juices are not a very good idea. Coconut water is fine. Vegetable juices are fine, but fruit juices are too high in sugar.
Sagarika is also asking what precautions one must take after a hysterectomy in the long term.
So the hysterectomy is with the ovarian removal or just the uterus?
I will ask her to unmute so that. Go ahead, Sagarika.
And at what age was it done? How many years ago?
Hello.
Hello.
Am I audible, ma'am?
Yes.
So I had a hysterectomy last year.
And what age are you?
Now I'm 51. At that time, I was 49 and a half years.
And your ovaries were removed too?
No, ovaries were not removed.
They were not?
No.
Yes. So you were not menopausal when it was done?
No.
You were having periods?
After it was removed, I didn't have periods.
Of course. But when when your uterus was removed, you were still having your periods. So
yeah, very long-term periods. It would last for about 5 to 6 days.
Right.
Heavy periods.
Right. So actually, there are no special precautions in terms of the uterus being removed. I mean, it's over a year. So you're back to whatever you were, 3 to 6 months after the surgery.
Yeah.
Right?
Yeah.
But whatever other women should do in terms of not becoming overweight and exercising regularly.
I'm not overweight, ma'am, but my belly is protruding.
Okay. So dietary changes, because certain kinds of diet cause more fat accumulation in the belly. So switching to the right kind of diet for you, which a nutritionist or a dietitian would be able to tell you. Exercising appropriately, different parts of your body, having a strong core, having a strong back, having a strong pelvic muscles. That is for every woman and also for you.
Amita, go ahead.
Yes. Good evening, doctor. Hi, Sukriti.
Hi, how are you?
I'm good. How are you doing?
Very well.
Very interesting session. And I would like to ask the doctor something. It's like I sweat a lot. It's been years. I feel it has increased and I'm into the menopausal stage. So how can I control? It doesn't matter about weather. It's just getting worse. When I come out of bath, when I wear something, or when I'm trying to, I just don't understand how this whole thing is, excessive sweat.
So it's like you feel
I'm 55 now. Yes.
If you feel a hot flash and then you sweat, which part of your body? Is it like the face and the upper part?
Not face, body.
The whole body?
Yes.
And you feel very hot suddenly. Is it like what is typically a menopausal hot flash?
Yes, I do. Like when I have tea, anytime I have tea or I have a bath, it just increases like,
You shouldn't have very hot baths. You shouldn't eat very spicy food. Your clothes should be, the cotton type, which let your skin breathe. And if you are very fond of hot tea, then you'll have to suffer the sweating. But otherwise, not taking very hot drinks and not having very hot food, spicy food, all these things reduce. But these are hot flushes, yeah.
I know there are a lot of questions that I still cannot get through, but one last question, maybe because somebody is asking on, they want me to ask on their behalf. 38, is it a good age to conceive? I'm trying. Any suggestions?
No.
So I think this is always the question about when to plan for becoming a mother, and is there any good age?
So the good age, of course, we all know the best age is if you're under 30 or closest to 30. And if you've crossed 30, then less than 35. When women don't plan conception till the age of 38, probably they have their reasons. Could be so it could be because of career or other issues. So I haven't really understood why the question of, is it a good age? Is it that she's been trying for a long time and hasn't conceived, or is she still thinking of conceiving and is 38? Is that right?
She says, as I am trying, any suggestions?
So she's been trying for a long time?
She already has one kid. She has an 8-year-old. So have you been trying for a long time? Yes, for 3-4 months.
For 3-4 months. Okay. So it's time to find out why hasn't it happened, because the first time she conceived, it happened quickly.
Did your first pregnancy happen quickly? Sorry, she's sending the private message. Yes, it did.
Okay. So if it's 3-4 months, there are certain basic things to be checked out. And, like maybe the husband's semen test and to check whether she's ovulating, some hormone tests, an ultrasound to look at how the ovaries are working. So all these things. Otherwise, 38 is a fine age to have your second baby. There's no problem with that.
I know there's so many questions, and I apologize to everyone whose question we could not get to, but I would like to get the doctor's last thoughts as we are stuck indoors. Any special precautions, anything that we need to do in this time?
So since we are stuck indoors, we should all use this opportunity to enrich ourselves. And there are so many things that we can do now, which we couldn't do when we were always busy running outdoors. So whether it comes to looking after our health and improving our health with yoga, exercise, the right kind of food, and meditation, all these things, maybe picking up a hobby, you can learn so much. There are courses online, so we can do that. Then there is, other things like things that you have always wanted to do, but you couldn't do. So I think we should feel glad that we have this time and make sure that we are in our best health in mentally and physically, and that'll improve our immunity and make us stronger and better people. And I think social work is another thing we can do, which we haven't found time for, to help others.
Well, thank you, doctor. Thank you for giving us your time today. I know you have a patient that you need to take care of. I think we're all, with gratitude, we thank you for answering all our questions, because this is a very stressful time for all of us.
Thank you. Thank you for having me. Okay, bye-bye. Bye, everybody.
Good night.
Good night.